Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Yeah, thank you for inviting me for this podcast. Actually, the topic which we are discussing, we are going to discuss today, it's a very
Yeah.
important topic. And lot of people, lot of misbeliefs, and lot of myths are around this topic. So it is very, uh, very need of the society to clear it off because so many things are involved with the topic like epilepsy, which we are going to discuss today. Thank you for having me here today.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Okay, definition wise, what we say seizure is it is a rapid, sudden onset abnormal electrical activities in the brain, which causes few symptoms like loss of consciousness, abnormal movement of the body, or infrequent blinking of the eyes, staring looks. What happens is our brain is made up of billions of neurons, and each neuron produces some electricity. Whenever there is firing of abnormal firing of these neurons, what happens, there will be a short circuit, and this causes the some symptoms in the body of the patient in form of loss of consciousness, sudden jerky movement, which causes seizure. So this is what we define seizure is.
Okay. And how does it affects the brain, doctor?
uh, Mostly all the neurons should be firing not simultaneously but in a synchronous way. When there will be an asynchronicity, that means every neuron is firing on its own, then there will be some disturbance in the brain. It is going to affect the mental health and the what brain controls our body, that control will be lost. That will cause loss of consciousness, abnormal movement, and sometimes delayed development in children. If it is happening, the child will be mentally retarded or delayed development will be there. So this seizure, every time a patient is having seizure, he is going to have some neurons is going to be dead from and this will cause some deficit in his sensorium.
What is epilepsy?
Okay, as I said, seizure is one or two episodes. Epilepsy is a syndrome which happens like seizure. If it is happening like unprovoked seizure more than two times, then we say it is an epilepsy. Most of the time, seizure is we can have an identifiable cause, but in epilepsy, same symptoms will be there, but there won't be we won't be able to find any clinical cause like uh, hypoglycemia, electrolyte imbalance, brain tumors, infection. So those unprovoked seizures where there is no secondary cause, which more than two, if it is happening more than two times, then we label it as epilepsy. Otherwise, if it is happening once or twice, then it will be called as seizure disorder only.
What are the different types of seizures and do they affect people differently?
Yes. Seizures, it affects like the symptoms of seizure will be depending upon which area of the brain is involved, which area of the brain there is asynchronous activities going on. So what mainly we classify seizures into two: focal seizures and generalized seizures. Generalized seizure is when the whole of the brain is involved, each area of the brain is having abnormal electrical firing, and 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 when focal seizure is when we have only one part of the brain having electric abnormal electrical activities. In that case, sometimes patient will be conscious but his eyes will be moving, his infrequent blinking will be there, and then there will be abnormal jerky movement will be there, but patient will be conscious. Furthermore, theoretically, what we classify is generalized is further classified into tonic seizures, tonic-clonic seizures, myoclonic seizures, absence seizures, where there will be only staring look, which will be lasting for 10 to 15 seconds. People will be talking to you, and they'll just stare at you for 10 seconds, and then again they'll be back with you in the conversation. So that is what we define as absence seizures. So it is very crucial to identify a person is having seizure. So how this is how we classify generally, depending upon the area involved in the brain.
I see. Now, Can you explain what causes epilepsy? Is there always a known cause?
Yes, epilepsy 50% of the time, like we won't have any cause. It will be very difficult to identify any particular cause, uh, or we can safely say that cause cannot be identified with the present technique which we have. But most of the time, like more than 50% of the cases, we can identify the cause. Like most common cause will be electrolyte imbalance. If a person is diabetic, hypoglycemia is going to cause seizure. Then any brain tumor, any trauma, any previous history of stroke. In elderly, the most common cause is stroke. Patient having stroke like CVA, hemorrhage or infarct, this is the main common cause. In children, most common cause is hypoxia, that is birth asphyxia, where the brain did not get proper oxygen during the delivery process, or during delivery if a child get any injury during the delivery process. So this is the two main common cause. Apart from that in children, febrile seizure is most common, in which case like a child less than 2 year or 3 year who is having going to have fever, there it is very common to have seizure also. In females, most common cause is like because of the estrogen in females, it is pro seizurogenic. The females during menstruation cycles, it is prone, they are prone for seizures also. The most common infection that to remember we can say is infection like meningitis, encephalitis, tumor of the brain, any trauma, any inflammation of the brain, any asphyxia, or a lack of oxygen to the brain is going to cause seizure. These are the most common identifiable cause.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Yeah, coming from the worst symptoms which we all know, like abnormal jerky movement, sudden loss of consciousness, and shaky movement of the whole of the body, frothing from mouth, uprolling of the eyes. The subtle symptoms which can patient have, which very often which any people or the patient himself can overlook, are like in case of absence seizure, patient will be talking to you and then for just 10 to 15 seconds he'll stare away. He'll be staring constantly, and then again he'll back to you with you in the conversation asking for what happened, like just a snap. So this is the most common which get ignored. Then comes like atonic seizure. A patient will be walking and suddenly he falls, like there will be loss of tone in the body, then suddenly he'll fall and then again he'll wake up and he'll feel कि okay slip हो गया, या फिर might be like some vertigo might have happened. And then other common symptoms are sudden anxiety or fear, severe fear कि somebody is going to hit me or somebody is stalking me. Sudden fear or any panic attack can also happen if the temporal lobe is involved. Also, if the visual area of the brain is involved, sudden loss of eyesight, like sudden blackouts, he's not able to see or person is not able to see, this may also happen. And in case of focal seizure, as I told you earlier, patient will be fully conscious and suddenly there will be blinking of the eyes or facial twitching, or any finger or the legs will start abnormal movement. So that can also happen. So these are the few signs which a patient will feel.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
The problem is historically what has happened is previously when we were not aware what was the cause of the seizure, people were thinking like we were had that concept ki some supernatural phenomena is involved, or a person who is having seizure, they are having it because of that previous birth sins. So people, and nowadays what people think is a person who is having seizure, she cannot, if a female is having seizure, she is not fit to marry, she cannot bear children. People will be like afraid to marry her, or people will be afraid to give job to that person. What they think is if they'll be in touch with them, they may also have the disease. They feel that seizure is a contagious disease. So that is why they are afraid, and this is what causing the society or this stigma or this taboo to remain till now also. uh, so these are the reasons. Few in villages or in rural areas, still people think it is some supernatural or divine power which is causing seizures. So that's why they'll be like non-touchability. Don't go to that person. Don't talk to them. It is still there. So what we need to do is we'll have to educate the society like with programs like this.
How does this stigma affect people with epilepsy?
As I told you, like if a female is having seizure, then she it will be very difficult for the parents to find a groom for that female. They'll be hiding it. You know, in society, they'll be hiding it. Ki my child or my daughter is having seizure. If a person is having seizure, in an adult male is having seizure, or a child is having seizure, he'll be discriminated in school. He won't be having a schoolistic performance. His personality, his self confidence, everything will be gone. A person who's having seizure, and if like colleagues will know or the employer knows, he'll be like, okay, he's not fit to do the job. So they won't, it is very difficult to find a job if a person labels himself or tells about his the seizure disease. Similarly for females, it is very difficult to find a groom, and there'll be people will think, okay, if she's having seizure, probably the child will also, her child will also have seizure. So these are the things in a, or in case of children, it is when the child has a seizure episode in school, his self confidence will be gone, his schoolistic performance will drop, and everybody will look, will have a, every child will start staring at him. Ki he has some disease which should not be like, we should not touch to him, we should not talk to him. So that self confidence early in the life, if it is gone, then he is not going to recover whole of his life. This is how it is going to affect the society.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Yeah, as I told you, more than 50% of the time, it will be some identifiable cause like infection. In case of sugar patient, uh, drop in sugar, hypoglycemia is most common cause. Then electrolyte imbalance. This can be easily managed. The triggers are like fasting should be avoided, excessive stress, lack of sleep. Any person who is having seizure, lack of sleep is going to trigger the seizure episode. Then skipping of the medication which when doctor prescribed, patients will think, okay, I have been taking this medication for 6 months, now I think I am cured. This self cessation of medication is one of the cause. uh, Apart from that, lack of good sleep, lack of exercise, uh, stressful lifestyle, these are the few trigger points which are going to. Yeah, one more thing is flashing, a sudden flash of lights in the eyes or a sudden loud noise. This may also trigger seizure episodes. So this should be avoided.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
One thing is, if a person is having seizure, he should understand that there are few things he'll have to do. As I said, the trigger points like loud noise, flashing, lack of sleep, healthy exercise like relaxation exercise, yoga, uh, good dietary control. If he is diabetic, good dietary control of sugar levels. These are things he'll have to be like fully managed, then only that seizure episode will be reduced. Another thing is, if he's having any medication, he should not stop it without any like without consulting a doctor ki, okay, from this many years we have been taking this medication, should I stop or not? So these things he'll have to be like bear in mind. And one more thing is counseling. He should talk to the doctor, and it is not a contagious disease. Regular counseling with the doctor is going to boost his self confidence and relieve his stress. So this will help.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yeah, of course. Uh, if a person is having seizure, the first thing should be, what we see is people will start putting something in their mouth, or they'll just sit on their them just so that he cannot move. This is a wrong practice. What we should do is, ideally, any sharp thing which is around that person should be removed. He should be laid on the left lateral position, most probably. Airway should be secure. That is, his mouth should be secured. Just try to put something soft like pillow or any your hand just below his head so that he cannot bang his head because he's not conscious. Then just relax and be with him. Reassure him every time. The seizure, most of 90% of the time, the seizure will last only 1 or 2 seconds. Once he is out of the seizure, that abnormal jerking is off, you should reassure him that he's good, nothing has happened, because it will take some 2 to 3 minutes to gain the full consciousness of what has happened to him. uh, or if you have something like, you should record the time, how much time he had that seizure episode. If mobile is there, it is better to record a video that helps a neurologist or a neurosurgeon to which type of seizure he is having. And apart from that, just call for help. Best thing is, you cannot manage any person who is having seizure alone. Always, if you are in a situation, always call for help. Call two, three people, but never let him have his seizure episode. Don't try to push him, pull him, or keep anything around him, put something in his mouth, nothing. The seizure episode will subside by itself 90% of the time. Just be with him and reassure him.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
I'll just say Caesar is not any disease which is contagious or which cannot be treated. With modern medicines which we have, Caesar can be treated 100%. You'll have to stick to the Caesar, medicines which are going through. You'll have to get yourself thoroughly evaluated with a neurologist or a neurosurgeon. Sometimes less than 10% of the cases require surgery, but Caesar is a treatable disease and it is not contagious. People need to just remind it कि the people, Caesar is not a contagious disease. It cannot spread by touching that person or talking to that person. That person need your support and need your help, and don't just ignore them. Just reassure them that you are with you. Half of his tension is going to go, and he'll be Caesar free.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.